Since September 25th, it's been a slow increase of cases throughout the state. And it's happened shortly after phase 3 was entered into in the state. And that's in cases and also in statewide hospital bed utilization, slightly up since the beginning of October. Total positive cases in Kent County, as of this morning, Bill's got 338 on the website. They have 340 and 35 new cases since the beginning of October, with 1 death. And we did have 1 facility-related outbreak at the Kent Center. That's since then been resolved. So right now we have a total, as of Bill's report on Friday, of 6 active cases. The rest of them have been resolved.
How many active?
6.
6 active.
We seem to be averaging, when Bill gives his reports, every 7 days between 7 and 10 cases. Continually, it stays pretty consistent.
Now, are these active cases you're talking about? I keep seeing on television that they're noticing a less severity, and they're not as severe as they used to be. Do you have any way of knowing?
It's a younger demographic than it was before, when we were in having a lot of cases. It was in the nursing homes and things. Now it's a younger demographic, and you'll see from what Bill's reporting, a lot of it is due to family gatherings and activities. Instead of in the facilities where it was the beginning. The facilities are doing a really good job now of keeping it out. So that's good news as far as, and it's keeping the deaths down for sure, and less severe.
But we don't know how many of these people are being hospitalized versus just.
Kent County, I don't think we have any hospitalizations.
That's what I was curious about.
That was the last I heard from, but it's been a few days now.
That's where I like that he's instead of just saying 338 cases, you can tell us how many people actually got it this week. That number means a lot more.
So total active cases, what the?
6.
Yeah, but what does that
That means
actually?
there's 6 people that are infected.
That basically have not gotten well yet. They're being treated.
But that 300 something that he was talking, that's since the beginning of the time.
March.
Right. I mean, I've always wondered, say, okay, a person gets tested, they're positive for COVID. Okay. And then they go back and test it again, and they're still positive. Is that another case, or is that?
No.
Okay.
Single case.
Okay.
Now, if they would go back a month or 2 later, not within the 2 weeks, if they're tested within 2 weeks, it's 1 case. But if 2 months later, they're positive.
Okay. Now, does this take into account, because I think it happens a lot here in this area, if they go to Middletown and get tested, does that reflect back here?
The system is supposed to report based on address of residence. So yes, if the system works correctly, yes, it's reported back here.
Because I think there may be people.
Because those reports, if they're tested in Middletown, it's supposed to come back to the Kent County Health Department to do contact tracing and notification and that kind of stuff.
Yeah.
Address of residence.
I didn't mean to interrupt you.
No, that's fine. Happy to answer questions.
No, I forgot it.
So like I said, the number of cases in the last 14 days was 20. And every week when Bill reports to us, it's somewhere around 8 to 10, something like that, during a week. Total cases by zip code, you can see on that slide, it's throughout the county. I don't think there's any area that doesn't have cases, or hasn't had cases. I don't know where the active ones are now. But like I said, it's 340 total in that, and 24 deaths. The 7-day positivity rate compared to Maryland is, we're below. We constantly are pretty consistently below the state rate. But as Bill keeps reporting, it's starting to tick up just a little bit. They don't know if it's a trend yet, but there's certainly something they're watching. You know, based on the weather change and people being inside more and the restrictions being lifted last month. So that's all, kind of keeping an eye on what's going on. And then case per 100,000, same thing. We're below state average. And we've been 87% of the days have been below state average in Kent County. Testing's continuing Monday and Thursdays, 8:30 to 12:30 at 514 Washington Avenue. The new lab is having results around 48 hours, so 2 days to get the results back, so that's not too bad. And you can see the levels that Bill's got here. We're third in the state for testing our population, so that's good. And it's a testament to all the work that the health department is doing, and the ladies over there at the testing facility are just fantastic. So. That's good news. And contract tracing, and we talked about it a minute ago, but what we're seeing is that the majority of cases appear to be coming from family gatherings. Certainly work outside the home with some, but at the high risk are family gatherings. The bigger the gathering, the worse the problem it could be.
We also just coming off of a summer where we've had an influx of people from all over the country into Kent County for the marinas, and it seems like to me with all of that went on this summer, we really fared pretty well.
I think we did. There was a lot of fear of that
Yeah.
going on for the first part of it, and it didn't come to be what everybody thought it was going to be, I don't think.
Right.
So that's good. And then Bill's last page here, the main challenges they have is that school's back in session and they're starting to play sports, and they're keeping an eye on that. They've got a COVID outbreak response plan with the schools that they're keeping an eye on, that Bill talks about in our EOC calls along with the school representative. And they're trying to integrate best practices for the school health activities. Robust program of testing, we've talked about that. It's a fantastic program that they're doing in contact tracing. The new CDC definition of a close contact has changed a little bit in the last week. It was exposure within 6 feet for 15 minutes. It's still that, but now they've added over a 24-hour period. So if you and I are close for 5 minutes and we separate and we come back again for 5 minutes, 2 hours later, if it's within that 24-hour period, it's considered, when it gets to 15 minutes, it's considered an exposure. So they've added that 2 weeks ago. So that's what they're looking for to consider when they're doing their contact tracing. If an exposure happened, if you have within 6 feet, no masks for 15 minutes or more in a 24-hour period, they would consider that a contact or an exposure. It's confusing.
Yeah, that's.
We gotta keep our meetings at 15 minutes stop in here.
Well, hurry up, man.
You're usually part of your permanent clear 15 minutes.
So they've completed their flu vaccinations. They did one in Delano, one in Rock Hall, and one here in town at the Public Works. Thank everybody that was involved with that. Kenny EMS helped out, the dispatchers, the Public Works people, everybody was great. The fire companies, really thank them for allowing access to the building. It makes it so much easier for them when they can have those bays where they can go in and out and stay out of the rain and stay out of the weather. So we really appreciate their assistance in that.
Did you see more or less participation, compared to other years?
I don't know, because I don't think they've done them like that in a while. They
Haven't
usually
done them like that?
they usually just do them at the health department.
Okay.
So,
Okay.
we were told that Walgreens is really busy in town, and I don't know the other ones that are offering, but Walgreens is really busy doing flu shots. And then they're working on a plan for countywide COVID-19 vaccination. We don't know when that's going to be. It could be in the next 2 months or so, but we're not sure. Certainly, the plan for the state is to have those vaccinations go to the people who are most vulnerable or most exposed at the beginning, because there are not going to be a lot of them out there. So that's kind of the plan for now. And I would just like to take a minute. I know you all know this, but I'd like to thank Bill. He's not here today. We've been working together for a couple of years now since Bill's been here. He and the health department are just fantastic, and I can tell you from talking to other directors on the shore throughout the state, we are very lucky in what we have. And Mr. Webb and his people over at the health department for the efforts they're doing. And they're struggling, they are, because it's been a heavy lift for them since March. But we are very lucky compared to some other counties that we have. So my appreciation to him and all his efforts.
Yeah, I think everyone in King County should appreciate what Mr. Webb has done, what his staff has done, and what your department has done, trying to fight this virus. I am of the opinion that it's here, and we're not going to wave a magic wand and make it go. It's going to do what it does, but in the meantime, we have to provide the PPE and the testing and everything to try to, but anyone that thinks that anybody has this magic wand, that they're going to just, okay, it's gone. They're just fooling themselves.
Now, the old timers older than me and you would tell you we need a good snowstorm to get rid of all that. That's what.
But, I mean, there's viruses, but, I mean, there's viruses in cattle, and, you know, we experienced that at one point, and that didn't make any difference what we did. The animals got it, and you did what, you treated them, you did what you could do, but, it ran its course, and it was, I don't know, maybe everybody got it, so then there wasn't anybody else to get it, so it was over then, but that's just, there's no one's gonna wave a magic wand and make this thing disappear. I mean, maybe that's my opinion, but, I just.
I agree with you. Nothing we can do to make it go away. All we can do, we've got to try to deal with it, and we have been, and I think we've come out of it, especially here in Kent County. We've just come out of here extremely fortunate and lucky, and maybe take a minute and talk about where are we at. I mean, like this building, we opened it back up, when was it, October something, for October 1st to let people in, to pay property taxes. We've let the press start attending these meetings. How's all that worked out?
I think it's been fine. I haven't got no reports of any issues. You've got a good person standing out at the door to make sure that everybody's temperature tested when they come in, and everybody's wearing the proper mask, and it's happening throughout. I had the opportunity to be over yesterday to do interviews all day long, and what I saw, I was completely comfortable in this building, and what Shelley's got in the range, so I think it's going well.
Now, community center's gonna open up the 1st of November, which is right around the corner.
All people want to get back to work.
Yeah.
Yeah, that's the tricky part. What happens when you start coming back inside? You know, my son's been practicing soccer outside for about 2 months, and they're talking about whether or not they're going to bring him inside, and you know, that's a little bit different animal.
Is it time that we start letting some people back in here? I mean,
I think what you're doing right now is perfect. I think we need to wait and see what this trend is looking like, and what happens when the weather gets colder, people are shut in more, and kind of take an evaluation of how the flu season's going. I think what you're doing right now is the way it should be.
Under your one figure here, I just have a question. I mean, family gatherings, I see it was the biggest problem. What, a dinner party, what's the difference?
I don't know. Maybe it's unrelated, people that aren't related getting together, as opposed to people who are related as a family. Probably showed up in their contact tracing as where something.
And then I'm looking here on the high-risk locations, and this is Kent County contact tracing, gambling facilities.
It's probably statewide.
Okay.
We don't have it.
Well, that's what I'm.
Unless somebody went to Cecil County or something and came back, you know.
we don't have any that we know of.
We don't.
Is this list statewide? What happens?
I think it would have
Maybe that's on the street, they're throwing dice somewhere.
That's some alley.
I mean, I don't understand the religious services to shopping. Like, how do you know if you got it in church, you got it when you went to the grocery store, and you got it at church?
I'd have to have Bill ask that, how it comes down.
You know, I don't know how they specifically nail things.
Yeah, you know, some of this gets a little confusing, even, you know, family gathering. If they'd been somewhere else before and then had a family gathering. So did they really get the family gathering, or did they get it when they went to the bakery to buy rolls?
I don't think there's ever a definite answer, but they can say that they were at some place where somebody ended up being positive.
Yeah.
And they turned up positive too, so that's probably what brings it home.
Yeah. Okay. Well, I just, you know, was curious. And I'm sure none of this is an exact science.
It's not. You're dealing with interviewing people, so it's not an exact science.
Right. And somebody don't want to tell somebody where they've been.
I'm not sure.
I think our bars and restaurants did an outstanding job.
Absolutely. Yeah, absolutely. it's gonna be a shame when the outside dining, it gets too cold for that, and, you know, I don't know how you deal with it after that, but, the summer ended up, to me, could have been a disaster, it ended up pretty good.
Well, I think that's the other thing, the health department, your office have all did a terrific job, but I think we also have to thank the people in Kent County for being aware of it and trying to, you know, follow the rules and do
Absolutely.
the proper thing. I think that's important. I mean, it's gotta be a working together of everybody.
And along with the volunteers, the volunteer fire companies, the EMS companies, we still have the rescue squad ambulance with us, sitting in Lynch. We can get it out once in a while. It's been great to supplement that ambulance when their system, the EMS, the volunteer system is stressed a little bit. We've had that up in our back pocket. When there was a lot of cases around, we were using it a lot, and they were kind of standing back a little bit. So again, my thanks to them, and the county should be very thankful for